Hi, everybody. Happy Easter. Happy Passover if you're celebrating. Um, it's great to be back on here. I had surgery on Wednesday, and about 24 hours after the surgery was over, I was released from the ICU and the hospital and was able to go home. This feels pretty miraculous. The doctor said that things went very well and that he got it all, which is the goal. It's been kind of a crazy experience for sure. I'm thankful for many things right now. I'm not feeling badly. I have had a little bit of pain, but it hasn't been too bad. And, you see a little blood spot here. This is where they pinned my head to the table, and there's a couple more back here. The incision was up and around my ear. And all in all, it's a pretty small incision. They were able to pull the tumor out from that little incision. And evidently my doctor, Dr. Smith, invented some tool that pulls tumors out of people's heads out of a small incision. So it's not a big incision. It is a little bit annoying in some sense because my hair when I'm trying to keep my hair off of it a little bit, and it kind of pulls a little bit, and that kind of stings sometimes. And I've had a little bit of pain, but I'm on pretty mild pain killers like Tylenol. I'm not on heavy narcotics, so that is super amazing. And I'm just taking it day by day. I'm walking a little bit, taking it slow. We went to Whole Foods earlier this week so I could get some baby shampoo. We normally use a shampoo bar, which is not great when you have staples in your head. And I navigated, getting into a busy grocery store very well. And we've been out to dinner a couple of times. And one thing is that they had to cut some of my chewing muscles here. And so chewing is challenging and somewhat tender. So I'm sort of gumming all the foods. But I'm staying on my ketogenic diet and just trying to feed myself properly, and I'm feeling very well. Going out to eat is pretty stimulating. Restaurants are loud places, and by the end of eating out, I'm pretty tired. But I've made it through. I've navigated busy places, and that feels like great progress. This whole experience has been a really big learning experience, both about myself and about how to navigate the medical system and the hospital and surgery and how to make it work. I learned how to advocate for myself during this, from turning down drugs that aren't okay with me. For example, they wanted to give me Pepcid AC at one point during my hospital stay to avoid nausea, and I told them, no, I'm going to have some broth instead. One of my dear friends made me a lovely batch of bone broth, and I brought it with me to the hospital. You can bring your own food to the hospital if you want, and maybe that's the best idea on a lot of levels if it's healing foods. Bone broth was my first meal after about 48 hours of fasting. I fasted starting Monday evening, all through my appointments on Tuesday and through surgery on Wednesday, because I wanted my ketones to be as high and therapeutic as possible, which is optimal. And the first meal I had was a cup of delicious bone broth. And my family said that the second I had some bone broth, I lit up and came alive again. So know that you have control over this, and don't always rely on the hospital to provide your healing foods, because sometimes they're not so healing. The first meal that they tried to give me in the hospital was a clear liquids diet. They knew I was ketogenic because it's all over my charts and all over the whiteboard in my room. But yet they tried to give me fruit juice, which I cannot drink, a little bit of broth, and Jell-O. Red Jell-O. I'm not putting that chemical in me. Are you kidding me? I just had brain surgery. So I turned it away and told them to bring me some scrambled eggs instead. And I drank my broth, and I knew what I needed. I turned away all medications that I know wouldn't help me. You know, the Pepcid AC was not going to help me with nausea. All I needed was a little something in my stomach, something soothing. And you have a choice. You do not have to do everything that they suggest. So I got out of the hospital, and I've been trying to sleep plenty during the nights. It's a little bit tricky to sleep because I'm a side sleeper, and I have, an incision right here, so I can't really sleep on this side, and so I'm trying to sleep on the other side, sleeping on an arm, or trying to sleep on my back, but my hair pulls on the staples, and so that hurts, but I'm making it through, and day by day it's getting better. My energy is better. It really feels like a miraculous recovery, to tell you the honest truth. And I have to give credit to all of the preparations I made beforehand, to my diet, to my amazing surgeon. Dr. Smith is amazing. And it is so comforting to know that I will be his patient for the rest of my life. I don't have pathology back yet. I gotta be patient because that won't come back until April 18th. So I don't know what we're dealing with here. This may be benign, it may be cancer, it might be any number of things, but what I do know is that I'm taking the right steps to stay healthy for the long haul and to avoid recurrence, because one thing I do know about tumors of the brain is that they like to come back. And so I will do everything in my power to avoid having to go through this again, and to take care of my brain and to take care of my body in general. When I first heard this news, I knew that, having this medical affliction would make me a healthier person, and that will be the case. So thank you all for your thoughts, your prayers, your messages, your calls. It's really lifted me up and helped me get through such a harrowing and traumatic process. I really appreciate you all for being my community, and I will continue to update you on my progress and my prognosis and my pathology as I get more information. Thank you.